We will discuss fowl cholera. What is fowl cholera? Fowl cholera is basically a contagious septicemic disease of chicken and turkeys. It normally occurs the adult birds, which are more than 4 months of age. There are two basic types of fowl cholera. One is acute, and second is chronic. We have one more like peracute, but peracute is just the disease without symptoms. So we will discuss them. What are the characteristics of fowl cholera disease? Number one is respiratory distress. Second is discharge from the mouth. Third is diarrhea. Fourth is swollen comb and wattles. And fifth one is high morbidity and mortality. Which bacteria causes fowl cholera? It's basically a Pasteurella multocida, which is gram-negative bacteria, non-motile and non-spore forming. When it comes in our mind that it's non-spore forming, then we can understand that it will be easily destroyed by ordinary disinfectant, sunlight, drying, or heat. It has 16 serotypes. Now we talk about the epidemiology, where it occurs or in which season it can occur. Fall cholera is more prevalent in late summer, like when winter is coming and summer is going. Fall mean autumn season, and in winter. Basically, this problem is winter problem disease. So, what are the main sources of infection? The main sources of infection of fowl cholera are body excreta of diseased birds that contaminate soil, water, feed, etc. Then the carcass of birds that have died of disease. Third one is contaminated water supplies such as surface tanks, ponds, lakes, and streams. And next one is mechanical transmission by contaminated shoes or equipments. In this diagram, we can see that the two most common birds which get infected are birds, poultry, chicken, and second is turkeys. So if we talk about chicken, then they can infect the ponds or lakes or with their feces or with their excreta. What will happen? They can contaminate this one as well as this infected water or contaminated water can also infect them. So when the infected bird will die, the raptors and avian scavengers will come. They open the birds and eat it. When they eat it, they also get infection and they are carriers. The disease. They are the carrier of disease from one place to another or from one shed to the another shed. Like when birds or raptors, avian scavengers will go to lake, they will drop their shit there. Then they will contaminate the water. One more thing here. Small mammals like dog, cat, rat, they are also a carrier. They are not, they cannot be infected, but they are carriers when they will eat infected birds. So they can cause outbreaks in turkeys as well as in chicken. So in this diagram, we can see that infection can come from infected lake by that contamination of infected birds. We can see here that this bird is infected and it is causing problem. It will infect all the other birds as well as contaminate the water of lake. So it will cause outbreak. Same is the condition when birds that do not become infected. What will happen? They will normally stay there They will be when there will be new birds coming, they can continue outbreak. So now we will talk about the transmission, how it transmits from one bird to the another bird. Within the flock, if we talk about within the flock, it can be transferred within the flock by contaminated soil, feed, and water. By cannibalism, can disseminate the disease when healthy chicks peck the dead birds. And second point is between the flocks from one shed to another shed. It's direct contact with the sick or recovered birds or their excretions, rats, predators, and insects, as already discussed. Vertical regarding vertical transmission, either they can transmit the disease from this disease can be transmitted from parent to the offspring. It's not possible. So it's not a vertical transmission disease. Here's an observation that larvae, nymph, adult ticks, Aspergillus, and dead mites also become infected by feeding the blood of infected birds, but don't transmit the organism. Mean they can get infected, but they cannot transmit the bacteria. Now the reservoirs of infection, mean carriers of the infection. The studies indicate that animals other than birds may serve as reservoirs of infection and actively spread the disease. Like dog, cat, rat, raccoons, these are the reservoirs which serve as a reservoir, but they cannot get infected and they can spread the disease easily. Second is these animals include raccoons, dogs, cats, pigs. We can count on pigs. Pigs are also a reservoir. They can also spread the disease. And this disease is rarely seen in chicken under the age of 4 months. So if our birds are less than 4 months or 16 weeks, then if there is any swelling of wattles or combs, we can count on other problems. Not we cannot focus on this because it's rarely seen. And but it is commonly seen in turkeys under the age of 4 months. Now we will talk about the clinical signs. Clinical signs, as already discussed, per acute. In per acute problem phase, there is only a death without any symptoms. So we will not see any symptoms and there will be a sudden death. Number of birds will be die. Second phase is acute. The clinical signs of acute phase is hunched up position, like standing in like a penguin. Foetid diarrhea means smelly bad smell or rotten eggs smell diarrhea. Respiratory distress, cyanosis, mostly in unfeathered area of the head, like near the comb or under the or around the wattles. These are the most common area where cyanosis occurs. Mucus discharge from the mouth. Then one of in acute we discussed that it will be die without signs. But in acute phase, what will happen? Bird will die within 2 hours of exposure. If bird is get infected and it's exposed to disease, it can be died within 2 hours. Mortality rate 10 to 50%, but sometimes it reach up to 70% within 8 days. So if we see the acute signs of fowl cholera, number one is this is the hunched up position, and in hunched up position there is another disease problem in which we can see the problem, like ascites. It's normally in laying birds, not rearing or other birds. So if the bird is laying eggs, there can be a chances of hunched up position. But if a bird is not in laying position, like it's under the age of production and more than the age of 4 months, it means it's fowl cholera. It's a typical sign of fowl cholera. Second picture is the diarrhea of yellow or green color, and this diarrhea smell will be like rotten egg. There is a sticky discharge from the mouth. We can see the rail and swollen wattles in broiler breeder. We can see it. The wattle is damaged as well as swollen. The swollen throat or swollen neck. These are common signs which we have seen in field. Now we will talk about the chronic phase. Chronic fowl cholera may follow acute form of the disease, result from infection with organism of low virulence. What will be the signs of chronic phase? They depend upon the types like forms, wattle form, arthritic form, nervous form, and respiratory form. If it's wattle form, then wattles will be fiery red and hard to touch. While arthritic form, the limb joint will be swollen and foot pads will there will be foot dermatitis. And nervous form, torticollis, like twisted neck. We have all, seen some cases like birds twist their neck. This torticollis can occur in other viral problems, but in fowl cholera it can be seen. But when we will talk about the diagnosis, differential diagnosis, we will not rely on this nervous form or torticollis. Then we will talk about respiratory form. There is a yellow caseous exudate in the air sacs. When we open the bird, we can see the yellow caseous exudates in the air sacs as well as in the respiratory trachea. And birds may be succumb, remain infected, and recover. One more thing to remember: either birds are recovered, they are still carrier of the fowl cholera problem. They carry Pasteurella multocida in their feces and in their excretions. Now we will see the pictures regarding chronic fowl cholera. This is serous inflammation of conjunctiva. We can see here the conjunctiva is swollen, and here caseous material in the conjunctiva. This is a torticollis form of fowl cholera. Sorry. Now we will discuss about the postmortem lesions. These signs, in the previous slide, what we discussed is the signs which we normally see when we enter into the shed. Now we will discuss the postmortem lesions. Postmortem means we are opening the bird and we will see the sign and symptoms. Acute, if we open the bird, dead bird, which has no sign and symptoms, when we will open it, there will be very small hemorrhages on the surfaces, on heart, on other organs. In acute form, there will be subserosal multiple petechial hemorrhages on viscera. Like in peracute form, we can only just see the hemorrhages on the surfaces. But in acute form, what will happen? There will be multiple petechial hemorrhages on viscera. Liver will be swollen and multiple small focal areas. It will be like cornmeal color, coagulative necrosis and heterophilic infiltration. There will be enteritis intestine will be severely red, hyperemic, increased peritoneal and pericardial fluid, free yolk, peritonitis, ophritis, regressed follicles. Now we will discuss about chronic form, postpartum lesions. Localized inflammatory lesions, ovary, yellow, putrid smelling material resembling cooked egg yolk, often surrounds the ovary and may fill the body cavity. While in lungs, there will be consolidation and having several nodules. Pneumonia is common in turkeys. Like if we talk about chicken, there will be consolidation and having several nodules on the lungs. But Turkey, pneumonia is the most common. It can be in chicken, but in turkey, it's common. What else? Greatly swollen and indurated, first a cloudy gray fluid and later a cheesy material. Like if you open the swollen waters of the bird, we have seen a bird and we seen a bird with swollen waters. We culled it and we opened its water. There will be a gray fluid. It's just initial chronic form. While if in later stages it will become cheesy material. Like last time we saw it in the conjunctiva. Next is caseous arthritis, hog joints involved, middle ear and conjunctival sacs, caseous exudate. Here are some pictures. We can see that waters are so swollen in broiler breeder as well as in the layer. Here we can see another picture. It's so much swollen. Here is another picture of swollen waters in broiler breeder. As already discussed, that hyperemia of chicken duodenum. Chicken will be like reddish due to hyperemia in fowl cholera. If we talk about different pictures or different organs, we can see that there are hemorrhages on the heart, or we can say subepicardial hemorrhages. Second is cornmeal liver, like small multiple foci on the livers. And if we talk about lungs, there are extensive hemorrhages and hemorrhages or particular area of necrosis, as in shown in this arrow. While if we see the picture number D, we can see that submassive necrosis with fibrinous exudate on pleural surface. And if we talk about the ovarian follicles, we can see that a network of blood vessels around the follicles. So it is a typical sign of fowl cholera. If we haven't seen any sign of swollen bottle or any other sign, but when we open the bird, we see that there is like boiled egg yolk or swollen follicle. It's indication of fowl cholera. Here is the broader picture of liver with cornmeal. We can see here in this picture also there are, you can see small petechial foci. These are necrotic foci on the liver. We can say cornmeal liver. And here on the heart of the chicken, we can see severe hemorrhages. These are severe hemorrhages all over the heart. So it shows like it was a acute or paracute outbreak. Here we can see that, as I already discussed, the swollen ova and covered with blood vessels. In both pictures, we can see the ovas are covered with blood vessels. In gizzard and proventriculus, we can see the outer side. There are hemorrhages on the gizzard and as well as on the proventriculus. These were the signs, symptoms of the problem. Now we will talk about treatment. Which medicines or which antibiotics we can give for the treatment of fowl cholera. Number one is penicillin. We can use penicillin. We can use tetracycline like OTC, oxytetracycline, chlortetracycline, sulfadiazines, erythromycins. These are the treatment antibiotics which we can use for the treatment of fowl cholera. Now we will discuss about the differential diagnosis. Like if we see this problem or these signs, with which problems we can differentiate it. There can be chances of that either this is a problem or this it's a fowl cholera. We will start with Newcastle disease. We already discussed that in Newcastle disease we see that there is a torticollis sign and there is loose dropping. But what happens in Newcastle disease? There are hemorrhages in proventriculus and intestine. Mean when we open the proventriculus, there will be pinpoint hemorrhages on the glands, while there will be also hemorrhages on the intestine. But in fowl cholera, there will be no hemorrhages on the glands of the proventriculus. Same like there will be no hemorrhages in the intestine. IBH. IBH means inclusion body hepatitis. In inclusion body hepatitis, there will be foci in liver that will be looks like fat globules. Okay. Infectious coryza. In fowl cholera, uh, comb and waters are infected, while in infectious coryza, facial swellings, mostly around the eyes. Fowl typhoid. In fowl typhoid, we have pallor throughout cadaver and thin watery blood and bile stained in large liver. Mean liver will be severely infected in fowl typhoid, and it will be stained with bile. Now we will talk about the control. There are different precautionary measures which we can take to minimize the disease. Number one is pick up and destroy all dead birds before they can cannibalize or fed by the scavengers. Like the wild birds, we have to dispose of all the birds and destroy them before they are cannibalized or eaten by the wild birds. Second is biosecurity. As much as we have strong biosecurity, we can overcome the problems. Number third is sanitation. Our cleaning and disinfection program. All in all out practice. Mean in one shed we have same age of birds. They are entering in the same day and they are leaving the shed on the same day. It should be the principle. Then separate different species of birds. Like we have ducks in same site, we have turkeys in same site, we have chicken in same site, they will be infected. But if we have only chicken at that site, it will be more safer as compared to the other involvement of other species. Fence off stagnant pools and drain rain puddles. Mean there should be no standing water or no stagnant water around the shed. It can also cause problem. Vaccination by bacterians and live vaccines. Now we will talk about sanitation practices. These are the sanitation practices which are helpful in the prevention of the disease. Number one is complete depopulation each year with definite break between older birds and their placements. Like we have one placement in November, so we have to at least depopulate the shed at least October, September, August. At least there should be a depopulation should be occur in July. Now, second is implement a rodent control program like rat baits, dog baits. We should place rat baits and dog baits around the shed so rats or dogs cannot enter into the shed or they cannot carry disease. Dispose of dead birds properly, then provide safe sanitary water. Our water should be free from the any disease or any bacteria like E. coli, coliform, salmonella. It should be properly disinfected with any chlorinated water, or we can use credence tablets. Next point is clean and disinfect all houses and equipments after disposing of flock. After depopulation, immediately we need to clean and disinfect all houses and their equipments. So the disease should be eradicated as soon as possible. Then keep birds confined to the house and away from wild birds and animals. That our shed structure should be like that. There should be no entrance for the wild birds like sparrows or other crows, any other thing, any other bird. Allow contaminated or range or yard to remain vacant for the at least 3 months. As what we discussed in this point, that when if we have depopulated the bird, the shed in November, then December, January, February. After February, we will put new placement for the infected shed, not other sheds, for the infected sheds. Now we will talk about the vaccination. If we vaccinate the flock during the outbreak, it will be least chances that it will be effective. So it will be just a wastage of money. We cannot say that it will improve the immunity of the birds. Second is bacterians. They are not always effective. They are most of the time they are effective, but we cannot say 100% that they will be effective. We can repeat their dosage like we can make 2 injections. First between the age of 8 to 12 weeks, and second about if we have injected first injection at the age of 8 week, then we will inject the second injection on 12 week. If we have injected at the age of 12 week, then we will inject on the 16 week. Live culture vaccines are only used in healthy birds. Vaccinate chicken at 10 weeks and then at 18 to 20 weeks. If we are using live vaccine, then we have to vaccinate birds at the age of 10 weeks one time, then the second time we will vaccinate after 20 weeks. It means almost 2.5 months. There will be gap of 2.5 months between first vaccine and the second booster vaccine. If you talk about the polyvalent vaccines, we can vaccinate inject first vaccine at the age of 8 to 12 weeks, then we can revaccinate them at the age of 6 to 12 weeks. Oh, sorry, 6 to 12 months later. That's all. Thank you so much. If you have any questions, please let me know.